Good day. Dr. O here, and welcome to Health Caring Differently, where we inspire diverse students to pursue careers in healthcare. Tune in, please. Just like this. You can find us on YouTube. We have been here every Tuesday at 7 p.m. This is actually our last live episode for 2024, but please do follow us on all of our social media platforms to learn more because next year we will be switching to a podcast format. So we definitely want you to be in the know and follow us on social media so you can be in the loop, gain valuable resources, and hear more about the next steps and the things that we'll be doing in 2025. The other thing that I always encourage you to do is sign up for our newsletter. Like this episode, whether it's live or it's podcast form, is for inspiration. You're going to hear our guest stories and you're going to, hear about the wonderful things people are doing. But the newsletter is where you get the information to match with that inspiration. And so in the newsletter, we give you info on diversity programs, on scholarship, and also in particular research opportunity, like summer jobs to do research. So for tonight, though, please feel free to drop your question for our guest in the chat during the stream, and I'll be sure to ask them for you. So again, today is our last stream for 2024, and the topic is leadership, diversity, and women's health. And so our guest today is Dr. Mojola Omole. Dr. Omole is a breast surgical oncologist and general surgeon at Scarborough Health Network in Toronto. She is the president of the Black Physicians Association of Ontario. So very excited and shout out to BPAO. And she is also a consultant for anti-Black racism and anti-oppression training. Dr. Omole is Chief Medical Officer and Device Consultant for the Stage Zero Collection, which is the first educational bra garment designed to teach people about breast cancer and symptoms in darker skin tones. She is a freelance journalist, and currently she is the co-host of the Canadian Medical Association Journal podcast. Welcome, Dr. Omole.
Thank you so much for having me.
Yes, no, I'm like really excited, and I'm like honored that we were able to like do this live for
Yeah, I'm happy to be your last live.
yes, for 2024. We might have other like live
Sure.
special episodes, but certainly, yes, we're gonna be switching to like the more podcast kind of vibe. So, like I just like to like jump right into it. Like I don't like, beat around. It's like let's go. Okay. So it's health caring differently. I did give that like bio of all the fantastic things you're doing, but let's, hear it directly from you. How do you feel that you are health caring differently?
I find that it's a really hard question to answer because I don't really have an answer because I actually don't know how other people are health caring. I just know that I'm health caring in a way that centers my community and that is broad because I have
Mhm.
intersecting identities.
Let's talk
Um,
about it.
oh, so okay.
Well, that's what healthcare. What makes you different? What are these intersecting identities?
So I think, first of all, I don't even just say I'm black. I am Nigerian. I was born in Nigeria, came to Canada when I was 8. So I am an immigrant. I'm viewed as black, but I stand very strongly in my Nigerian ancestry.
Mhm.
I'm in a surgical field that is majority male still. Things are changing. So that is part of my identity. I'm a single mom by choice. I chose
Mhm.
to have my son he came in 2020.
Mhm.
Also queer. And so all of those identities are kind of part of what my lived experience that I bring into health caring.
That is fantastic. And that is so important because that's really what health caring differently is about. There are diverse people in healthcare, but it's about the fact that we bring our whole selves, and all of our identities or how we decide to express our identities and do things differently because of that. And I would argue probably improve healthcare because of that, because we know
Sure.
these journeys.
Yeah, and I think that for some people, it's hard sometimes to bring all of their intersecting identities. There's always whether there's emotional safety. For me, I feel extremely blessed to be where I work that I'm able to do that.
Yes, yes, and that's it. So I said and sometimes people show certain identities if they have the privilege to hide some, and so there's an authenticity dance that we have to do in our journey, and we have students listening. So sometimes you can't be your full authentic self. Sometimes there's a performing self,
Of
right?
course,
And that is normal. But over time, hopefully, you're able to do that dance in a way that you can feel more and more authentic
for
where
sure.
you work.
I
Hopefully.
always tell students that medicine is 90% performance. No one knows what you're thinking, and so you have to express yourself. And oftentimes, the people who are the loudest get the most attention. You don't have to be there, but you have to understand that part of what you do is performing. And honestly, part of how you make patients comfortable is by showing them your confidence. And for sometimes that does feel like a bit of a performance if it doesn't feel natural to you, but it is part of being a good doctor also.
It is, and that's why I said it's a dance. Like, sometimes people can find it very stressful, but over time, it's a bit of a dance. Your authentic self in front of your mother is different than your authentic self in front of your friends, but it doesn't mean that you're a fraud or something like that in front of your mom. But if it's completely the opposite of who you are or against your values, that's where the stress can come.
100%.
And so how has your journey been in medicine, carrying those different identities? How have you been able to bring that into your work as a surgeon and bringing it into, like, the women's health context, the Black health context, all of the things?
So I would say that, like, I always start off by making it clear that, I am a Nepo baby. My father was a general surgeon. And I always strongly believe that for those, much has been given, so much is
Mm,
required.
mhm.
I was raised with a really strong sense of giving back. And so a lot of my journey in medicine, my medical school residency, was really like my dad was my first and probably still my only mentor.
Aw.
He's passed away, but he's still pretty much the person that I would consider like one of my biggest mentors, because he really was someone who was able to guide me throughout the process. And I hope to be able to do the same for the students that learners I get to mentor. And so part of my journey, I think that is similar to others who at our age. I mean, I didn't know any word called microaggression back in 2003. It wasn't something we talked about or anti-black racism, but no amount of privilege or nepotism in a way can protect you from those things. And so definitely, those experiences were always there. Being doubted, being told that you weren't a strong student, that you weren't a good talker, which is odd because
What?
part of how I make my money now is by talking. So
Yeah.
interesting. And so those
Mm.
were all experiences that I don't necessarily think were necessarily like unique to me. I think a lot of us had that. And then just trying to find my place in surgery that, I wasn't someone that necessarily wanted to do a 20-hour case, even a
Mm.
4-hour case. I don't either. 3 is like my max. And so after 3, I'm like, oh, this is tiring. So, trying to kind of find my place in it. And I really struggled up until my 3rd year to really find my joy within medicine. And that was when I started realizing that I really do want international surgery and international health to be part of my training and also part of my practice in the future.
Oh, that's fantastic. And I know so I know the question is probably coming, and so your identity as, like, a Black woman and a Nigerian woman, but particularly a Black woman because of the anti-Black racism I'm asking, as a Black woman and a surgeon and a mom, because you mentioned, like, long surgeries, right? So how have you been able or have you been able to kind of find, that balance where you might be experiencing, I don't know, like, at this point in your
Mm.
career, sometimes questions around, either anti-Black racism or sexism, right? The subtle things, but at the same time wanting to balance being a mom and being present as much as you can, or you know what I mean? How is that particular mix of identities worked out
I
for you as
actu
a surgeon?
I actually think that, like, to be honest, I do actually feel quite lucky. I trained at McMaster for my residency, and our program director at the time was like, "Go have babies, all of you. Like, if you want babies, have them. Have 2, have 3." Some had 3. And she really
Okay.
took a whole year off. "You'll never get this time back." Like, she was, and it really set this tone in the program that you can do this if you want. I chose not to do that, but it really kind of made it, like, clear that, "Hey, like, we can do what we want to do. You can be a surgeon, and you can also," like, I can't be a neurosurgeon, but I
Mhm.
can do this and also have a family. And I think that that modeling that I saw earlier on in my training kind of really imprinted in me that anywhere that I wanted to work, I wanted to make sure that there were other female surgeons doing the same thing. I work in Scarborough. The site that I work at 3 out of 5 of us are females.
Oh,
Everyone has
okay.
kids. Our chief has 3 kids, right? And, and so it's just like, and, she is a present mom. She is, obviously, I think part of motherhood is that you wonder, like, was I present enough? Did I do this enough? I think that's all part of it. But, so I think that for me, I was really intentional in making sure that I was always going to be in a position and a place where my identity as a mom, I didn't know if I was going to be a solo mom, but that I wanted to be able to be in a place where it is welcomed. And
Mhm.
I have friends who don't have that experience, who have the opposite, where they're questioned, about their ability to be a surgeon and to be present and having kids, and saying, "Well, you know where you'll find her? She'll always be at Costco," making like disparaging comments like that. It is the opposite where I am, and so I really like I adore my colleagues,
Mhm.
but I think that my first imprinting in residency made me to always look for people like Susan Reed that would do that.
Okay. No, that's great. And I think that is one thing that where you can do it, especially when it comes to choosing where you work, because sometimes it's hard when you're applying for
Yeah.
medical school or, if it's nursing school, where you go where you're accepted, and if you're accepted in many places, then you choose CARMS. It's like pretty, the residency match pretty direct. But I think we have to be intentional about, if you do have options, being intentional about the
Yeah,
environment and the culture of where you're going to study or work actually really makes a big difference.
massive.
Um, and so I wonder also about, um, not only I find sometimes it's not always like explicit homophobia, but you mentioned self-identifying as a queer woman. And so heterosexism though happens, right? Like just the subtle, I guess, microaggressions that are homophobic. Um, did you experience any of that, or do you see that in colleagues, or do you have advice? I'm thinking particularly about our audience, about students who, either might not have come out yet, but you know what I mean, or have come out but are
Yeah.
curious about, particularly in surgery.
I think for me, I mean, like in training, like I heard some like super homophobic things, not directed to me, but directed to other people.
That's what I mean, in the
Um,
culture. Yeah.
yeah, and I think that the culture has definitely changed. I don't think people's opinions have changed. I think they just know how to hide it better,
Mm,
which sometimes might be fine because you don't want to fight every battle.
mhm,
I think for me that, and I think I have a privilege of being someone that most people assume is just straight up heterosexual. Like no
mhm,
one even thinks about everything. I do think it's more challenging if you're not someone who, who is feminine and you are queer. I think or if you're non-binary. I do think all of those makes it more challenging. So for
yeah,
me, it's a little bit easier because people don't necessarily assume that.
mhm,
But I haven't like I find that sometimes my bluntness just like it breaks up people's ability to like then try and make an insult because it's kind of like, when someone says to me, "Oh, something about like my son's dad," I'm like, "He doesn't have a dad, sperm donor 34739." And then they're
yes,
like,
I've heard that one
"Oh."
before. Yeah,
And I'm like, "Oh." And then I was like, "Okay." And I just keep on doing my work because
right,
it's like, and it makes it very clear that like you can try, but I'm not the person you're gonna try to make
right.
any kind of snide comments about. And so I find that like, I say it in like a ha 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 joking way, but I'm not joking.
But yeah,
Yeah.
you've cut through that ice. Okay. And I think that's important. So the culture is still there, but I mean the I guess the heterosexism is still exists in
Yeah, I
certain,
definitely. And I would
but
say to
the
students
culture
that
has shifted so that it's not, you know what I mean, like overtly, not as overtly, you know what I mean?
it's not as overt, but I definitely think that, you know, queerness in certain aspects is much more acceptable in medicine. But like for our trans community or non-binary community, that is still not acceptable. Like,
Yeah,
when I was at Mac, we had an emergency physician who's, openly a trans woman who people would make comments about. I'm just like, well, and so I think that there is still an element of like, oh, I have never like. So
yeah,
I think that still occurs, and
yeah,
part of it is just educating people. Like I also do provide trans care, and so every time before we have a trans patient doing surgery or non-binary, I always talk. I was like, okay, like the ID might not match what their name is, but let's still go with what their name is because we don't want the last thing they remember before they fall asleep to be dead naming them because that doesn't feel good.
yeah.
And like people are actually pretty receptive to that. If someone has an opinion that differ, or if they're transphobic, there's no space to actually voice that opinion, which
Right,
to
it
me is
won't
fine.
be tolerated. Yeah, which is, yeah, exactly. We don't want that. And I've worked with some trans medical students, so we're seeing more trans medical students coming into medicine than before. And so I think that is good. But yes, I think these things take time, and I think overall things are improving, but I think we still have a long way to go. We do have a question.
Mhm.
So I'll jump straight to that question. But then the next thing, just so you have it in your head, I want to talk about diversity in medicine and your role
Okay.
in UPAO. But the next question. So we've got Janelle Olu. And so Janelle says, what advice would you give to your younger self or to aspiring Black women surgeons who are considering motherhood about balancing these roles?
So I would say two different advice. I think the what I would give to my younger self is that don't like you are exactly who you think you were. Don't let other people's opinions try to determine who you thought you were. Because I think oftentimes I kind of always thought that I was pretty good. Like I was like, okay, like I was someone who believed in myself. But the process of medical training
Mm,
really made me doubt myself, and it's just been problem in the last 5 years. And I'm like, I am exactly who I thought I was. And so that's what I would tell my younger self is that whatever you like, what you believed inside of you was always the truth.
yeah, no, your spirit speaks, and if you feel like you are supposed to be in this healthcare field, be a surgeon, then yes, like it's that energy. You have to believe in yourself. It has to come from internally and not from the outside because there's so much noise and nonsense that can come from the outside. Also, it's that Nigerian energy though. It's that, do you know who I am?
Exactly. It's 100% like I'm Nigerian. I'm just like I'm 100% Nigerian. Like like I do like the whole concept of like self-doubt. Like it was weird. It didn't fit because that was not the way that I was raised or what I saw modeled around me and my parents at all.
Yeah,
So it was weird times like internally because there was always that struggle. I would
yeah.
say that the advice in terms of trying to balance is that don't Instagram, TikTok,
Mm,
portrayal of motherhood
mm.
isn't real. It's fake. All of it is fake.
Yes.
The process, the time of sitting down and creating the perfect sensory box, it's crap. My child did not do any of them things. And understanding that you get to define what motherhood is for you. For me, I get to spend a lot of time with my kid because my mom lives with me. My mom helps me raise my child. And I don't have any problem with it. I think oftentimes, people believe that, well, for me to be a mother, I have to do these things. I have to bake these things. Like
Mm-mm, girl.
there was a bake sale at my kid's school. I went to the bakery around the corner from me. I was like, can you all make cookies, but make
Thank
them in a way that it looks as if I made them?
you.
Because I can't make them.
Right?
And they're like, "What?" I was like, "I'm not making cookies. I have to bring something. I don't want to bring a bag of like cookies, but I'm like, y'all make great cookies, so just make them a little less perfect, and then I'll bring it." And that's what I
There you
did.
go. Yes.
Exactly.
That is it. So I am co-parenting, but I have two women from my tribe, so two Igbo women who live with me, and one of them loves to, bake and whatever. Her and the kids made candy apples or something like that, and then she
Mm,
called me because the candy apples wasn't finished, and I'm supposed to put the caramel or what. I'm like, no, I'm not doing. I'm like, I love you. I appreciate that you
I
did this
love that.
for my children. I'm like, whatever's left of the caramel, they will dip. I'm like, I'm not doing.
Exactly. Like, I mean, like, I love
I love
cooking, I
them.
love doing all those things, but I don't I'm not a Pinterest, like, mom, and that's just not me, and I know some people who still are, and they're still surgeons, but
Love.
make sure whatever definition of motherhood that you have is the one that you have, not one that has been influenced by others.
That is correct. So, yeah, part of that balance is recognizing your own strengths, joys, weaknesses, and finding that balance. And then what we are talking about, Dr. Omole is talking about her mom living with her. I have, extended family, if you like, of the village living with me. And so it really is part of that balance because it's not always a balance. It's a juggle act. And sometimes you do
Mhm.
drop balls. But the juggle of it is the village. And so I think this
100%.
idea that you do it on your own is a terrible idea. And whether that's with, like a husband or other family members or whatever, I think it requires like a whole team of support to really be able to have a career in particular and feel fulfilled in motherhood.
100%.
And even at its best, there are still challenges because
Of
parenting
course.
is parenting and it's
Yeah.
it's tough. So, but please keep that in mind. It is not about doing things alone, but really having supports in place as much as you can. Okay, I talk a lot, but we actually have more questions coming in. So, but I love the hack, like get it baked and tell them to make it imperfect. I love that. Okay, so Amber Claire says, can you speak more on international surgery, right? Because you mentioned that was part of
Yeah,
your
so
intro.
I have a fellowship in it, and so I spent 2 years in Rwanda. It was I don't actually know if like Clinton, it was the Clinton Foundation that had partnered with the Rwandan government to help because of the genocide.
Mhm.
There's a middle cohort of um, physicians who were gone. So they would
Oh,
have been like people a little bit my age and a little bit older.
mhm.
And so part of it was, but then they had like crops of medical students coming up, but then there's this gap of people who were killed during the genocide. And so it was basically to try and fill that capacity over 7 years in different fields in medicine, nursing, social work, midwifery. And, it was a really transformative experience for me. Um, I mean, I think I'm a I'm an international health flunky because what it leaves you with is a deep sense of they don't need me. They need government to step in and actually serve the people.
Yeah.
And there were some aspects that definitely like I was needed, but really what is the most important thing is creating a structure where healthcare and when I say healthcare, it's not just about like surgery or medication, it's about nutrition, it's about, access to, clean water, access to roads to get to a hospital,
Yeah.
to get to a health clinic. That is what's actually needed, is that capacity building is actually more on our governments being a little bit tougher on other governments to take care of the population. So I kind of left slightly jaded, but definitely still, valuing the importance of it. And, I grew up with my dad trained here, then went back to Nigeria because that was always the goal. And then we came back again. And so there's always that part of me that really does want to be part of expanding access to care in different parts of in different African countries.
Yeah. No, I think it's interesting and it's important I think it's important to have those experiences because it really can change your perspective on global health, on policy. For me, I did an elective in pediatrics, particularly pediatrics and HIV in Nigeria in Abuja, so at the National Hospital. But those experiences really can be like life changing as far as the kind of work that you want to do or how you see the world or how you see medicine. So I do encourage those who are able to do it, especially if it's to your own motherland, like to your own ancestral land, it hits differently in the way that you think about it. Um, Now, coming back though to Canada, this land and Turtle Island, then um, there's the piece around how we can transform medicine here, because that's kind of what happened to me after I spent time in Nigeria. I felt like it was such a drop in the bucket, and I felt like I could make a difference here within our diverse population, right? So I really ended up focusing. I was always interested in, Canadian and immigrant and racialized healthcare and Black health, which is what it ended up being. But that experience solidified it for me. So now on this land, Dr. Omole, you are a leader and you are, involved in a number of, anti-racism and diversity initiatives. So what are the things that are bringing you joy? What are some of the things that might be bringing you concern when it comes to diversity in medicine and the future of healthcare transformation?
Let's start with the positive. What is bringing me joy is I really, really love mentoring students. I was a basketball coach when I was in university for
Yay!
Boys and Girls Club. So I've always really loved connecting with younger people. And so being able to mentor medical learners has been something that's been a great joy in my life. And that's kind of my hope in medicine. Like sometimes when I think of, working in systems, I'm like, well, I think we just need to just start rebuilding it and trying to like we can try and change a few things, but really let's focus on the learners to really build capacity, and not just Black learners, but all learners, whether you're racialized or you're non-racialized. It does take a coalition to do something. And the desires for various groups, and even within those who identify as Black, to be white adjacent is the problem in our system. And naming it, because we have a lot of internalized anti-Blackness
Mhm.
in us, and a lot of people have like internalized or just
That
anti-Black.
that's what colonization does, right? It makes
Yeah.
you internalize the racism. Yeah.
And so being able to dismantle that at that level first, I think is, one of the most important things. What worries me is that it's definitely taken over in the US with rolling back, excuse me, all of the efforts post 2020 to increase diversity and equity. And definitely it's coming here. I do think there's going to be lawsuits that are going to challenge, different um, application stream for equity deserving people. And I think that we need to be aware of that. I also think that it's important that non-Black and non-necessarily equity deserving groups understand that their healthcare is going to suffer if we remove equity and diversity in medicine. Studies have shown when you treat the most vulnerable, everybody's health get better,
Yes.
right?
Yes.
Like when I talk about, okay, we need to change the screening guidelines for breast cancer, especially in Black women. Well, it's not just Black women. That is a disproportionate that have early state, like get breast cancer at an early age. But there's a lot of other people who also benefit from those interventions. And so I think it's important that people are aware. I've seen some worrisome TikToks from younger people talking about the issues that they have with diversity and with initiatives to bring equity. And I really want people to think about that including others does not exclude you.
Yeah. Yeah. No, that's it. And I love that you said that it does improve healthcare. I mean, overall in healthcare, we've learned more and more, and in medicine, like, yes, there's the what we call the biomedical pharmaceutical model of disease, and then you treat with medications. But most illness actually and most health issues are related to social determinants of health,
Mhm.
right? These social factors that impact people's health. So to you students who are diverse, even with all of the stuff that we're talking about, where there's going to be, some resistance and some controversy and some discussion around diversity in medicine and equity groups, please know that you are much needed to actually bring the dignified care that is necessary in healthcare, that you are needed for that healthcare transformation, because most patients are experiencing some form of struggle or exclusion or different structural barriers of different sorts. It could be white folks who have experienced trauma or poverty. It doesn't all have to be racialized necessarily, but understanding a journey of struggle either in your community or personally. If you come into medicine or to healthcare, there's a different way that you relate to that patient. There's a different way that if you are at the leadership tables like Dr. Omole is, you bring a different perspective that is required to actually lift everyone up. And that is the piece that I think some people don't always realize or recognize, but
Yeah,
that is actually what's needed for healthcare transformation. So we need all of you. So please do
for sure.
apply. Know that it's not perfect. It's a hot mess sometimes, but you're still much needed.
Yeah.
You're still much needed. Um, and so for you, like, what has been as not only are you a surgeon and a mom, and we talked about all of these different identities, but you're also a leader. And so what has been your journey in leadership? Like, had you been involved in leadership, I don't know, from like birth? Like, there's some people who from kindergarten, they're like, no, this is what we doing. And then you kind of just, you know what I mean, bring that into medicine. Or did you have that, but then you dropped it when you came in medicine? You're just trying to, sometimes we're just trying to fit in.
No, I've
Completely
always had
different.
leadership. It's always been like no, I've always been like I'm the middle child who acts like the oldest. Like and so that's just like the energy that I've always brought in. And for me because I did like I was active in sports. So that was always a part of for me that's where I learned leadership was that, being captain of the team, then coaching, in university and university at Western, I was president of the African Student Association. I did a lot of those things. And then when I came to U of T, I was president of the Black Medical Student Association. So leadership has always been, I guess I never thought of it back there as necessarily like leadership. It was just like, okay, well, something needs to be done. I have an idea. Let's do it this way. And so that's kind of the way I always approached it was like, okay, how can we improve for our community? And then how can we improve for other learners who look like me?
That's fantastic. And yes, you do give off that like leadership energy, right? That vibe. And I think it's much needed. But I guess in your path through either pre-med or medicine, like, did you face, I mean, you talked about sometimes people kind of making you doubt yourself. So did you face certain challenges either in thinking of yourself as a leader or just as a medical student in general, or pursuing the pathway to surgery? Like, was it always just like, yeah, I know who I am, I'm going, and you go? Or how were there some challenges and some barriers along the way?
I think there were probably barriers that I wasn't necessarily aware of that, and sometimes ignorance is a little bliss. Like it was just more like, why are they being mean to me? Why is this not working out? And I still have that where I'm just kind of like, wait, why didn't I get that position that I applied for? Like that's weird. And I do think that with some reflection with my therapist, that a lot of it is I am someone who is not really great at like I can code switch. Like I'm pretty decent at switching, but when it comes to things that I'm actually passionate about, I don't code switch. And
Mm.
oftentimes, I do think that that will prevent you from being at certain tables. My best friend and I were talking. It's like there are Martin Luther Kings of this world, and then there's Malcolm X's of this world. You have to choose what feels the most natural to you.
Yeah.
I think that I'm probably not a Martin Luther King.
Right.
And so, therefore, be in spaces where you can be your full authentic self. And I think you need both. We need both types of leaders and know which one you are and be able to move in a way that feels true to you. That's how people are going to connect to you is
Yeah.
when they think you're authentic and they're like, okay, this person is, they're walking their talk. This is what they're doing. They know what they're doing, and this is who they are. And I
Yes.
think staying true to yourself, I think, is very, very important.
Yeah, no, I think that that's key, and you're right. I mean, there are consequences no matter what you do. Like if you are engaging in that performance of who you are not, sometimes you're rewarded for it, but then after
Mhm.
it takes a toll. It takes a toll on your
100%.
mental health, and we see folks like that sometimes have a breakdown like later on because it's just too much. And then yes, the people who speak their mind at the table a lot sometimes don't get all of the opportunities, right? Because they were blunt and their boss was there or whatever. So I think that's important. And code switching is its own thing. Like I think for me, I do code switch a lot. And for people to understand, code switching is like if you're in a more, let's say, white or dominant culture environment, speaking in a certain way, and whatever the lingo is of that, right? And with in public health is like, of course, the stakeholder engagement and let's take that offline and what you know what I mean. It's that kind of corporate talk. And then it's kind of different if you're, you know what I mean. I'm at Carnival or something like that, and I think that kind of code switching for me, although it can be very stressful for others, I grew up doing it just because I grew up half
Mhm.
Trinidadian, half Nigerian in Quebec. So even language wise, I just always had to be constantly rotating. So for me, it actually feels okay to do that because I'm just used to actually doing that. Like if it's Trini, I'm like, hey, auntie and ting. And then the Nigerian family is, hey, how now? Like I'm just used to doing
Mhm.
that because that's how I grew up. So it's a little bit easier for me than I would say for some of my colleagues. I've had meetings where like I've had, medical students, they might not be Black, but they might be from like Scarborough or grew up in a certain, they're like, how did you just enter the room and like change your tone? But what I'm saying is the same. It's still authentic to me. So
100%.
I think it just really depends on the person, and where you feel more comfortable. And in this journey, you might not always feel comfortable in every space, but please do have a vision for yourself, like Dr. Omole has done, to end up in spaces that feel authentic. I think it's really unfortunate where some of our colleagues are still not in those spaces,
For sure. And I
and
think you
it's
also have to realize that sometimes being uncomfortable does not mean that it's not safe and that you have to learn how to sit with being uncomfortable. That is a hard lesson for me. I'm someone who I hate being uncomfortable. I hate being cold. I hate being wet. Like I don't like physical discomfort. And so I
Mm,
really hate emotional discomfort. But it's learning that like sometimes when something is uncomfortable, it's not necessarily all bad. Sit with it a little bit and then assess whether this is safe. And I think oftentimes when you do come from racialized, Black and racialized backgrounds, and you're like, I grew up in a town of 3,000 people. We were the only Black family.
mm,
So that, like, medicine is very comfortable. It is actually what I'm more comfortable with because that's what I grew up with for 10 years of my life, my formative years. And so I would say that sometimes you have to assess and take some time to be like, is this uncomfortable or is this not safe? And sometimes it is just uncomfortable and you might have to sit through it and push through it to get to the next stage. I know a lot of students don't love to call, don't want to get on the phone because it feels weird to talk to people on the phone. I'm like, but you know what? That's a really great way of connecting with people.
yes. And I love that you said the discomfort and connecting. And y'all, I'm just speaking of discomfort and connecting. I'm trying to make y'all uncomfortable because Dr. Mole has to log off soon. So if you have any last minute questions, this is the time. But I think that piece that you just said about being uncomfortable is and reaching out is really important
Yeah.
for finding mentors. But we are underrepresented in medicine for finding mentors who do not look like you, who can be champions. And it means running into people who might not be so empathetic, right? You have to keep at it. And it's uncomfortable. It's uncomfortable to email people, call people, ask for stuff, and them say no. And to, you know what I mean? To keep trying. But that's key. That's key,
Yeah, and
actually.
I honestly, sometimes you email me. If you catch me on a great day, my phone's in my hand, I'll respond right away. Sometimes, like my mentees know, you gotta ask me 3 or 4 times, and then
Yeah.
I'll do it. But it's just like I'm just there's other things that I'm thinking that I have to do that I have to get back to, and so I think that does it feel well I don't want to feel like I'm begging. I'm like, no, you are begging. Ain't nothing wrong with begging.
I'm
You
saying.
gotta beg for what you need, and
That's
so
it.
like if your goal is to become a nurse, if your goal is to become a physician, if your goal is to become a healthcare administrator, you're going to have to beg sometimes for people to be engaged with you,
Yes.
right? And that's okay.
Yes. I was very much into begging whoever would give me this, enter the lab, get the opportunity, like, um, know people's schedules, show up when they're gonna be at their car because the
100%,
head of
yeah.
the pharmaceutical company where I wanna work, you know what I mean? I wanna
Exactly,
work as
yeah.
an undergrad student. I'm like, "Oh, funny bumping into you in front of your car." Um,
You gotta
right?
do what you gotta do to get what you want.
So yes, we do encourage you to, yeah, I love that, knowing the difference between discomfort and when it's not safe. Um, and so, okay, so I think we're going to wrap up and just, I mean, you already gave some pearls and some advice to a student who might be thinking about pursuing healthcare. Is there anything else that you want to let people know other than they should be following you and the BPAO on Instagram and
I'm,
LinkedIn
like,
and
not really
everything?
great. I'm not a social like, I don't like I have a Finsta, like, I'm not someone who's out there in
Well,
terms of my
BPAO, I see your videos. The
yeah, yeah,
BPAO,
so follow BPAO.
yes, BPAO.
We
That's what I
have a
said. Follow
women's
you on
health
BPAO.
a Black Women's Health Conference coming up on, um, Saturday, so I would love for people to engage with that and, be part of it. And really just, like, BPAO has a lot of things that they're doing for Black learners, for those who are interested in medicine, so please engage with it. Community of support at different universities across the country, engage with them. Um, Understand that, many of us I think sometimes people think the best mentors are not necessarily going to be us. It's going to be others who don't look like us, but realize that there's many of us, and that's part of the internalization. But many of us are here rooting for you. I personally, because y'all need to take care of me at a certain point. Like I need you to take care of
Right?
me when I'm old. So
Ah.
therefore, I'm also investing in my own personal future. But we're rooting for you. We want to. I want to be your colleague.
No, I love that. And folks, don't forget in the newsletter, we're always letting you know about like communities of support. We will, let you know about the latest updates from BPAO, and we always, share. And thank you to BPAO for the support for health caring differently. So thank you in that for that as well. And yeah, the other thing about mentors is it's not mutually exclusive. It's not somebody who looks like you or doesn't look like you. Take all of the mentor. I have had many mentors in different combinations at different times and like mix and match. And as Dr. Omole said, like it's just whatever you need, go for it. And you know what I mean?
For
Don't let
sure.
that stop you. So thank you. We will.
Thank
So
you
I'm
so much,
hoping,
and this is great. And I look forward to hearing the podcast when it
yes.
becomes a pod.
Thank you. Yes, so we'll be doing that in 2025, but I loved having you tonight for the live. Again, thank you to BPAO and thank you, Dr. Omole, for all that you're doing. You're doing so, so much and just being fire. So, like, thank you.
Thank you.
Yes. All right. So this wraps up our last live episode for the year. And so thank you again to Dr. Omole for joining us today, but also thank you all for tuning in for every Tuesday for the live episodes. We will have more live episodes in 2025, but they might be special editions. Overall, we are going to be launching all of these episodes into pre-recorded podcast. So it'll still be health caring differently, but you'll be able to listen to it anytime on YouTube. And so that's it. So this was the last one. We will, take a break for December because rest is important. So our whole team, including me, needs some rest. But we look forward to seeing you in the coming year. Thank you for watching. Please follow us on social media. Sign up for the newsletter so you can hear all of that great information about community of support and more. And yes, we wish you a really great December and a really awesome new year. And we'll see you in 2025.